Hi, I'm Brian Fisher. I've been a GP in South East London since 1976, and I've seen the NHS and social care go through so many changes. The people I've worked with have been smart, committed, and dedicated to their social care jobs, but they have increasingly found themselves working in a system that doesn't meet their needs, nor the needs of the users of the social care and support, nor the needs of unpaid carers. I've spoken to older people who found themselves naked in a bath because their carer had to rush off to another job. Their schedules were packed so tightly. I've seen so many people who were not eligible to receive social care even though they are vulnerable. The system has had to shrink so much that 26% fewer people are receiving care. I've spoken to people who feel they can't make decisions about their own care without fighting endlessly against a resistant system. People I know can no longer afford the fees of the assistants whom they employ. I know so many unpaid carers of all ages who are desperate for support, tired and worn out. The system is sadly failing them too. I'm in touch with councils who have had to cut vital services to keep social care going. It's a nightmare for them. And yet I work with social workers who collaborate brilliantly with GP practice staff and clinicians to support those for whom they have a responsibility. All this is partly because the government has cut funding by 60% in the decade to 2020, with cuts since 2010 larger in poorer parts of the country. It's partly because the vast majority of the service is privatized, with small businesses struggling to survive and large residential care companies raking in 12% profits from this shrinking pool of funding. It's a travesty of social justice and civil society. That's why I support the National Care Support and Independent Living Service NaCSILS campaign. We offer a comprehensive vision that we can all be proud of and feel that we and our families get the care and support that they need and deserve. We want a publicly funded, free at the point of use social care service paid for on the same basis as the NHS, public provided, not for profit, nationally mandated but designed and delivered locally, co-produced with service users and democratically accountable. A service based on inclusion and independent living, underpinned by the United Nations Convention on the Rights of Disabled People, underpinned by staff whose pay and conditions reflect true values and skills, designed to meet the needs of informal carers and informed by a task force on independent living led by user-controlled groups from diverse backgrounds. Join us and save social care. Thank you.